Ever considered how ethical decisions could significantly impact the life of a patient in a nursing scenario? Welcome to a world where compassion meets morality, where the human touch intertwines with the principles of right and wrong. This is the world of nursing, a profession where ethical dilemmas aren't just theoretical constructs, but everyday realities. But what exactly does ethics mean in the context of nursing? At its core, ethics in nursing is about making decisions that are morally right and just for the patients. It's about respecting their rights, ensuring their well-being, and promoting fairness in care. Now let's delve a little deeper. There are 4 fundamental ethical principles that serve as the bedrock of nursing. These principles guide nurses when they're faced with complex decisions that involve their patient's health and life. Firstly, there's autonomy. This principle speaks to the patient's right to make their own health decisions. It's about respecting the patient's independence and acknowledging their capacity to understand and weigh the implications of their choices. Next, we have beneficence, which is all about performing actions that contribute to the well-being of the patient. It's the nurse's duty to act in the best interest of the patient, promoting good and preventing harm. Thirdly, there's non-maleficence. It's a fancy term, but it simply means do no harm. This principle insists that nurses must not act in a way that can cause harm to the patient, either through acts of commission or omission. And lastly, we have justice. This principle dictates that nurses should treat all patients equally, with fairness and impartiality. It's about ensuring that everyone has equal access to healthcare resources, regardless of their background or circumstances. Each of these principles plays a vital role in shaping the ethical landscape of nursing. They guide the actions of nurses, helping them navigate the tricky waters of ethical dilemmas. Remember, the ethical decisions we make in nursing can make a world of difference in a patient's life. So let's continue to explore these principles in depth, shedding light on their importance and application in the nursing profession. Imagine a scenario where a patient refuses a life-saving treatment. How should a nurse respond? Let's dive into a real-life case study that brings to light the ethical principle of autonomy. This principle is critical in healthcare, and it mandates that patients have the right to make their own decisions regarding their treatment and care. Consider the case of Mr. Smith, a 75-year-old man diagnosed with a severe form of cancer. The doctors advised surgery, which, though risky due to his age and frail health, could potentially save his life. However, Mr. Smith, understanding the risks involved, decided to refuse the surgery. He wished to spend his remaining time in the comfort of his home, surrounded by his loved ones. As healthcare professionals, we might instinctively want to convince Mr. Smith to undergo the surgery, believing it to be the best course of action. However, we must remember that the principle of autonomy takes precedence. Respecting Mr. Smith's decision, even though it may seem counterintuitive, is an essential part of ethical nursing practice. This case study underscores the significance of the nurse's role in advocating for the patient's autonomy. The nurse must ensure that Mr. Smith is fully informed about his condition and the potential outcomes of his decision. Despite the emotional strain of such situations, a nurse must provide unbiased information, support, and care, respecting the patient's decision at all times. But what if Mr. Smith's family disagrees with his decision? Here, the nurse's role becomes even more challenging. The nurse must facilitate open communication between Mr. Smith and his family, helping them understand his decision while respecting their emotions and concerns. In this delicate balancing act, the nurse must tread carefully, upholding the principle of autonomy without compromising empathy and understanding. It's not about winning or losing, it's about respecting the individual's right to make decisions about their own life. In respecting autonomy, we uphold the dignity and freedom of our patients. Through this case study, we see the critical role that nurses play in advocating for this principle, navigating complex emotional landscapes, and ultimately fostering trust and respect in healthcare relationships. Did you know that a nurse can be held legally accountable for a patient's welfare? It may sound intimidating, but it's an essential part of the nursing profession. Nurses shoulder a significant responsibility in healthcare. They are on the front lines of patient care, often making critical decisions that can significantly impact a patient's health and well-being. But with this responsibility comes the potential for legal liability. One of the most common legal issues nurses face is negligence. Negligence in nursing can occur when a nurse fails to provide the standard of care that a reasonable and prudent nurse would provide in a similar situation. This could be anything from administering the wrong medication, failing to monitor a patient's condition, or not reporting significant changes in a patient's health. Another area where nurses can be held legally accountable is malpractice. Malpractice is a form of negligence, where a nurse's actions or omissions cause harm to a patient. It's important to understand that malpractice isn't just about making a mistake. It's about acting in a way that a competent nurse wouldn't, resulting in harm to the patient. Informed consent is another crucial aspect of nursing that carries legal implications. Informed consent is the process where a healthcare provider educates a patient about the risks, benefits, and alternatives of a given procedure or treatment. The patient must fully understand this information to make a knowledgeable decision about their healthcare. If a nurse fails to obtain informed consent, they could be held liable for any harm that results from the procedure or treatment. But remember, these legal responsibilities aren't just about avoiding lawsuits. They're about ensuring that nurses provide the best possible care to their patients. They're about making sure that patients are treated with respect, dignity, and compassion. They're about ensuring that every decision a nurse makes is in the best interest of the patient. Being aware of our legal responsibilities is not just about avoiding lawsuits, it's about providing the best care possible. So let's continue to strive for excellence in our practice, mindful of our ethical and legal responsibilities. What happens when a nurse's error leads to a patient's harm? Let's delve into a real-life case study that illustrates the grave consequences of negligence. In the late 90s, we saw a tragic case that unfolded in a hospital in the heart of New York. A young woman, we'll call her Jane, was admitted for a routine appendectomy, a fairly straightforward procedure. However, Jane's experience was far from routine. Due to a series of unfortunate events and oversights, Jane suffered severe complications that dramatically altered her life. The medical staff, including the nurse in charge, overlooked Jane's allergy to a specific type of anesthesia. Despite the information being clearly noted in her medical record, the nurse failed to double-check this crucial detail before administering the drug. As a result, Jane had a severe allergic reaction, which led to anoxic brain injury, a condition that happens when the brain is deprived of oxygen. This negligence didn't just result in a medical malpractice lawsuit against the hospital, but it also drastically changed Jane's life. She was left with permanent neurological damage, affecting her ability to speak, walk, and live independently. The nurse, once a highly respected professional, faced the devastating consequences of her negligence. She was suspended from her job, faced a disciplinary hearing, and her license was eventually revoked. The emotional toll of knowing her error had caused such harm was immense. The hospital too faced repercussions. Beyond the settlement they had to pay, their reputation suffered, leading to a decline in patient trust. The incident served as a stark reminder of the importance of thorough checks and balances in healthcare. It led to a complete overhaul of the hospital's policies and procedures to ensure such a devastating error could not occur again. This case underscores the significance of the duty of care in nursing. It's not just about medical knowledge and skills, but about vigilance, meticulousness, and unwavering dedication to patient safety. A moment's negligence can have lifetime effects. The responsibility we hold as nurses is immense. How does professional conduct shape the nursing profession? Let's delve into this pivotal question. Professional conduct in nursing is like the backbone that supports the entire profession. It's the set of behaviors and attitudes that nurses bring to their work every day, and it's vital in fostering trust and maintaining the profession's reputation. At the heart of professional conduct lies honesty. Nurses are often privy to sensitive and confidential information. The way they handle this information with integrity and discretion has a profound impact on the trust patients place in them. When nurses are honest, they build a bridge of trust that enables patients to feel secure and understood. Communication, another cornerstone of professional conduct, shapes how nurses interact with patients, their families, and other healthcare professionals. Effective communication is more than just conveying information. It involves active listening, empathy, and clarity. It's about making patients feel heard and understood. It's about collaborating effectively with the healthcare team to ensure the best possible patient care. And let's not forget respect. Respect for patients, their families, and colleagues is integral to professional conduct in nursing. Regardless of a patient's background, health condition, or personal beliefs, they deserve to be treated with dignity and respect. This respect extends to colleagues as well, fostering a positive work environment that ultimately benefits patient care. In essence, professional conduct in nursing is about upholding the values of the profession and maintaining its reputation. It's about creating an environment where patients feel safe, heard, and respected. It's about working collaboratively and treating everyone with dignity. But it's not just about the individual nurse. The professional conduct of every nurse contributes to the public's perception of the entire profession. Just as a string of pearls is only as strong as its weakest link, the nursing profession is only as respected as its least professional member. Professional conduct is the cornerstone of trust in nursing. And trust is vital in our relationship with patients.